Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Menopause Awareness. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, Orange County area, all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join our community, please visit our website at cscsouthbay.org. Before I introduce today's speaker, we ask you to keep your microphone muted to eliminate any distracting background noise. Please feel free to enter any questions into the chat function found at the bottom of the Zoom window at any time, and there is time for a question Q&A at the end. Without further ado, I'd like to introduce our workshop speakers, nurse practitioners Nancy Siskowic and Erica Buck, both nationally certified menopause practitioners, will share their wealth of information with you as well as personal life stories to increase your knowledge and awareness of estrogen's role in diminishing hot flashes, sleep loss, brain fog, joint pain, weight gain, loss of libido, moodiness, and so much more. Thank you, Nancy and Erica, for joining us today.
Well, and thank you for having us today. And today, as Ben mentioned, our topic is menopause. And we want to share both of our journeys with you because we think you'll really relate to what both of us have to tell you today. But before we start, I want to clear up some important misinformation that seems to be just out there so strong. Hormone therapy has gotten a very bad rap. We've heard that it causes breast cancer, it causes blood clots, it causes heart attacks, it causes strokes. And that information has scared millions of women over the last 22 years off of hormones. But we want you to understand today the correct information. And we want to dispute that information that was reported in one study, the Women's Health Initiative, that really scared people. And if you can see this, the Women's Health Initiative, the day that it canceled, the gentleman got on the TV and said, take your women off hormones. There's a 26% increased risk of breast cancer. Now, here are the statistics. Stay right up here on top. There were 8,000 women getting a sugar pill, a placebo. And in that group of women in a year, there were 30 breast cancers. There were also 8,000 women on hormones. And in that group of women, there were 38 breast cancers, 8 more. Now, 8 happens to be 26% of 30 in the placebo group. It certainly was not 26% of women, because that would have been 2,000. What you need to know is that in this study, they used an oral estrogen and a synthetic progestin. And that progestin, it was a sort of a potent stimulant of breast tissue, and that could have been somewhat responsible for those 8 more. But 8 more is in the rare category. It was 1 out of 8, 1 out of 1,000. So most people do, in years that have passed, the statistics do look better. Anyway, we also heard loud and clear there's 100% increased risk of blood clots. Now, there were 8,000 women that were getting, again, a sugar pill, a placebo. In that group of 8,000, there were 11 blood clots. The treatment group, there were 22. It wasn't every woman. It was 11 more. And the important thing here is that what they used in the study was oral estrogen. Birth control pills had been on the market for quite some time. And we knew from the oral estrogen in birth control pills that there was a slightly increased risk of blood clot, strokes, and heart attack. So this was absolutely no new information at all. Today, we mostly use transdermal estrogen, that which goes in through your skin. It's safe, and we use progesterone, not Provera. Both of these, estradiol and progesterone, are like the body's own. Well, you may have heard the word bioidentical, and that's pretty much what we use. So if you're reading anything about hormones, always see if they distinguish between oral and transdermal estrogen. It makes a huge difference. Oral estrogen can cause problems. And that day that he got on the air, the gentleman, he said, clearly, get your women off hormones. As I mentioned, I believe millions of women went off hormones, doctors stopped prescribing, and medical schools stopped teaching about menopause. So many of the young doctors today know nothing about menopause or about how to treat the symptoms that we're having. Worse yet, the FDA, right after that study was published, changed the wording in every single estrogen product to read, the risks outweigh the benefits. That has not been updated, though organizations have begged the FDA to change the wording. Hopefully one day they will. But here's what we have. We have 50 years of many, many studies that tell us estrogen is both breast and cancer protective. It does not cause breast cancer. Actually, it's been found that women diagnosed with breast cancer while on hormone therapy live longer and fare better than those not on hormone therapy at the time of diagnosis. Now, when I use the term hormone therapy, I'm referring to mostly estrogen and progesterone, but in many cases, testosterone. That's an important hormone also. So in the literature, there's too often no distinction, as I said, between oral and transdermal. Transdermal are such things as patches, gels, and creams. Oral estrogen goes first pass through our liver, and that's where it can do some of the damage that it does. Both Erica and I pretty much only prescribe transdermal estrogen. Okay, so Erica and I also believe that hormones are safe, important, and they support our brains, our bones, our hearts, our private parts, our muscle mass. We see less diabetes in women on hormones and less colon cancer. So what I'm going to do now is ask Erica to please tell your story.
Okay. So my menopause symptoms started when I was in my mid-40s. The hot flashes, night sweats, and frequent wakings at night were definitely problematic and interfered with day-to-day life and my overall mood. I was all of a sudden anxious about so many little things and had just little tolerance for minor problems. I was experiencing a ton of joint pain in my hips, knees, and feet, and having frequent bouts of these little fleeting dizzy spells. I did not chalk all of this up to menopause. I knew the hot flashes and night sweats were part of that, but the dizziness, joint, and foot pains were new, and I had never associated that with menopause. The anxiety and irritability I just attributed to getting older, being busy, having kids, work, life, just general life. When I sought help for the joint and foot pains, I was told that I needed to stop running, which that's my happy place. That's what I do for just mental health and physical health. I also saw a neurologist for the dizziness, had an MRI, which was totally normal. And I specifically asked my providers at that time, could the joint pain and the foot pain and the dizziness be caused by the hormone changes that I was going through by menopause? And I was told blatantly no, that this was not part of that. When I talked to my provider about the hot flashes and night sweats, I was also told that I wasn't a great candidate for hormone replacement therapy because my mother had had uterine cancer. Now, she had a rare non-hereditary form that I was told I was not at risk for, but then still cautioned against using HRT. So at that time, they suggested I start an antidepressant and then added gabapentin, which is an anticonvulsant, for treatment of hot flashes, because they both can help with hot flashes. The medicines did somewhat help the hot flashes, but did not help mood, didn't help sleeping, definitely didn't help joint pain, or the dizziness. In fact, some of them made the dizziness worse. The other problem that cropped up while I was perimenopausal was that I had not had periods for 2 years, and then all of a sudden I would get random heavy clotting periods just out of the blue. There was no rhyme or reason to these. There was no scheduling. It was really inconvenient and quite embarrassing. I had to start carrying an extra set of clothes in the car just in case. So I was told then that my symptoms would most likely improve if I would start to eat healthy and exercise regularly, which on one hand, I was exercising very regularly and eating very healthfully, but I was also being told to stop exercising to get rid of the joint pain. So I was kind of in a quandary. What was I supposed to do? And I really felt like I was starting to go crazy. I was spending money on supplements. It didn't improve any of the symptoms, but on the other hand, I was afraid to stop the supplements, thinking that if I did, maybe the symptoms would be even worse. That's when I found Nancy, thankfully, and she took the time to educate me about hormone replacement therapy and all the benefits of it. She helped me understand that there was a ton of fear about hormone therapy, and that there's widespread misconception, like she mentioned, about the risk of estrogen's role in breast cancer, heart attacks, blood clots, and strokes. She really reinforced the benefits and the importance of hormone replacement therapy in disease prevention and health promotion. It decreases our women's heart disease risk, which is the #1 killer of women, decreases osteoporosis, Alzheimer's, and other neurodegenerative diseases. Like she also mentioned, decreases colon cancer and type 2 diabetes, not to mention the powerful effect it has on mood, relationships, and the ability for women to continue working and thriving at this point in our lives when we really have a ton to offer still. Studies have consistently demonstrated that in women who are on hormone replacement, have a decreased their all-cause mortality, so risk of death from all causes, is decreased by about 30% when compared to women who are not on hormone replacement therapy. It definitely highlights that it effectively reduces the incidence of heart disease, again, the #1 killer of women, when on hormone replacement therapy. Back to your question for me, Nancy, my long-winded answer. I primarily went on hormone replacement therapy for joint pains, and it helped tremendously. It also helped my mood, my hot flashes, my night sweats, and just made me feel like me again, and really kind of brought peace back to the household again. And I really didn't feel so crazy. So
Beautiful.
that is my story. Now I know
Beautiful.
it's Nancy's turn now. She has a story that I think many people in the audience will resonate with.
Good. And I'd love to, I'm going to tell it. But first, I want to say, in the last many years, I've been doing this work for a lot of years. I cannot tell you how many women have come to me saying, I have to quit my job. I can't function anymore. And I have said to them, no, give me a chance. Let's go on these hormones. And bingo, they're back and able to, function and not have to leave their jobs. So now, I would love to share how I got into this crazy menopause field that I'm in. At age 49, I became a nurse practitioner. I wanted to be a therapist, so I became a psychiatric mental health nurse practitioner. And after finishing that 2-year program, I went for my pap smear. And my gynecologist mentioned simply in passing that the area, the South Bay here, needs a therapist who can work with women's hormonal issues, PMS, postpartum depression, and menopause. Well, I awakened 2 mornings later thinking, I want to be that person. So I called back to Long Beach State, talked to my professor, and asked, could I come back to the gynecology nurse practitioner program and simply concentrate on PMS, postpartum depression, and menopause? They said yes. They rolled out the red carpet, and I went back for another 2 incredible years of education. Back to my GYN for my next PAP. told him what I had done, and I asked, will you please set it up so I can speak to the gynecologists in the area, pretty much all of whom I knew because I had taught Lamaze childbirth for 20 years. His response was a zinger. He crossed his arms, sat back in his chair, looked at me, shook his head, and said, no, I want you to come to work for me. And I was completely taken off guard, completely speechless. And all I could say was, I can't do that. I didn't go to school for that. But God love him. He talked to me and he convinced me that I could. And so almost immediately after I started working for him, he would call me into his visits with perimenopausal and menopausal patients. And that was to educate me, but he would also ask my opinion, which blew my mind. So that was my birth as a menopause practitioner. I was 53. I'm now 84, and in private practice, simply doing menopause consults. When I was 77, tough year of my life, I was diagnosed with breast cancer. I was scared. You know that. Who wouldn't be? But I wasn't terribly surprised because my maternal grandmother, maternal aunt, and cousin all had breast cancer. And I knew with my family history, I was at increased risk. I had been on hormone therapy over 18 years. My tumor was indeed estrogen and progesterone receptor positive. It was a stage 2, no lymph node involvement. And there was also some DCIS, precancer cells, in that breast. Turned out I needed a second surgery as the DCIS margins weren't clear with that first one. So then I had to have radiation. So that was followed by 20 days of radiation. Now with this diagnosis, my doctors all said, you've got to go off estrogen. It'll kill you. It'll kill you. So I reluctantly went off of it. And before long, my statement was, this is killing me. Let me explain that. I had cried one Sunday morning with my husband, Ed, after making love, telling him this part of our relationship is maybe over. There was a statistic I knew, 60% of 57-year-old women not on estrogen are no longer sexually active. Because without estrogen, everything down there dries up. It's tragic. Women talk of no interest in sex, pain with intercourse, bleeding, and an inability to achieve orgasm, and eventually saying, forget it, I'm just not interested. And then, of course, along with that goes the loss of all those lovely intimacy behaviors that make for a relationship. The kisses, the hugs, the hand-holding, those all go out the window. And that's another tragedy. Partners don't realize most often that this is hormone involvement, that her hormones are shifting and diminishing. They're confused and left wondering, does she still love me? Does she have someone else in her life? So it can be very difficult for partners, especially when it was a good relationship and now, everything seems different. But this perimenopausal or menopausal women may not understand either what's going on. So often they don't. It's so important to get the correct information so you can talk about this loss of libido openly with your partner. Too often, neither really understands, as I said. So now back to me. It wasn't long after stopping my hormones. I was having hot flashes, night sweats, poor sleep. I'd kick the covers off, pull them back on. I was irritable. I was edgy. And I asked my husband, who had to walk on eggshells, literally, before I gave a talk, what he remembered. And he will tell you I wasn't myself. I was depressed. I'd snap at him. I didn't want to do things. I became very isolating. I wasn't the same person. And those are his words. But the scariest part of stopping my hormones was I would forget things. Words were gone. I'd forget in the middle of a sentence a word that I wanted to say. One day I sat down to write a thank you note for an orchid plant I'd been given for my birthday. That word was gone, nowhere to be found. So I worked around the house, went back to my desk. Worked around the house, went back to my desk, no word. Worked around the house, and finally, late afternoon, I Googled houseplant that blooms. And there it was, my word, orchid. So I finished my note, thank God, but then I sat there devastated. Like, horror of horrors, I'm getting Alzheimer's. Here was the worst. My sister had just a few years earlier died in a locked Alzheimer's unit. So I was certain that was exactly where I was headed. Sure, I was following her footsteps. It was very frightening. I said to my husband, I have to stop working. Words are disappearing. I'm forgetting names. I start a sentence and forget what I was going to say. I'm losing it. That was my worst day, and I remember it well. Yet other symptoms were occurring. Bouts of anxiety out of the blue, my heart pounding, especially at night. Yet also during my hour of quiet that I do each morning, it would happen. Or out of the blue, I'd suddenly feel sad, depressed, sometimes break into crying, even sobbing. I did have cancer, but nothing was going on that would cause me, I don't think, to just dissolve into tears. My understanding of all these reactions, the pituitary gland up here in our brain, picks up on the fact that there's not enough estrogen anymore. So we experience what's known as vasomotor syndrome. We have surges of adrenaline that brings on anxiety, heart palpitation, not sleeping at night, mind racing, hoping we can get back to sleep. But you know what? Even though we're asleep, there's still small surges of adrenaline that occur that don't wake us up, but they do pull us up out of that deep, important, restorative sleep. So we end up being sleep deprived, exhausted, no energy to exercise or do much of anything else. There's also drops in 40% of us, and I was one, in something called noradrenaline. When you have a drop in noradrenaline, it brings on this sudden episode of tears, crying, sobbing. And I'd say to myself, what just happened? Nothing. It was crazy making. One episode would end, and I just knew another one was lurking right around the corner. A symptom I didn't experience at this time was weight gain, when the brain literally picks up on the loss of estrogen and the body in its wisdom puts on mid-body fat cells, because in those fat cells, the body can synthesize or make a little bit of estrogen from the testosterone our ovaries are still kicking out. But that's not enough. Our brain wants more. So guess what? More fat cells, more fat cells. So losing weight is very, very difficult for midlife menopausal women not on hormones. Back on estrogen and progesterone, and bingo. I see it all the time. Women can lose weight with work, but they can lose it. The testosterone our ovaries do continue to push in or kick in can also cause hair loss, like male patterned hair loss. So what we want to try to achieve, think of this as testosterone and this is estrogen. When our estrogen is down, our testosterone is dominant. So if we have some estrogen, there's more of a balance. And that's what we want, more of a balance of estrogen and testosterone. So these symptoms and all of this craziness that was happening to me, I can honestly say turned out to be a gift, because it almost forced me to get going, to start researching on hormones after breast cancer, to talk to menopause experts at the conferences that I went to. I even made an appointment at City of Hope, an oncologist there, and she listened. Nobody around here, none of my doctors could listen to me. She looked over all my paperwork, did her exam, and said to me at the end of our visit, go back on estrogen. That was music to my ears. But it took me another full month to get all the other voices out of my head before I could put on my loving patch. So after 4 months without it, It's back on. And I was back in no time. A few days later, I felt like myself again. It was wonderful. And actually, Ed and I were on a Christmas cruise down the Rhine River. I loved him again. I loved people. It was fun. I was outgoing. At times, my flirtatious self again. And I can't tell you how much that meant to me. Now, I found myself journaling many days during this journey of mine without estrogen. And that seemed to help keep me sane, keep me in the moment. That journaling in my menopause background became a memoir of my experience called, and we just brought a copy, The Menopause Lady, which is my story and also an educational piece about menopause that I wanted to share with women. I'd like to just quickly share one little excerpt from that. Breast cancer completely blindsided me. During my morning quiet times, I begged God not to let me die. There were lots of tears. I was off my hormones after 28 years, having these hot flashes, night sweats. I was exhausted, isolating, irritable, brain dead. My breast cancer index was low, which meant my chance of recurrence was low, as was the chance of aromatase inhibitors being of benefit. That was low. And I have to say, thank God. I was pleased by that. My life was changed forever, and now it's a new norm. I have tremendous gratitude, love, and awareness that I could die tomorrow, or I could live to be 100. I'm living on God's time. But with any new ache or pain looms the question, is the cancer back? And I do my best to let go and trust, to let go and trust. And there's a book that I think all of you should be aware of that are worried or have experienced breast cancer, called Estrogen Matters. The author is Bluming, B-L-U-M-I-N-G. If you get the second edition, which is the latest, chapter 3 of Estrogen Matters is all about hormones after breast cancer. It's beautiful. When I got that book, I read that chapter 3 times in the week, one weekend, because it was so validating of what I was doing. So for me now, it's been almost 8 years, and I get blood work twice a year looking for cancer markers, so far negative, and I'm so grateful. I am more of an advocate than ever for hormones. And, you know, Ed and I can be out socially, and it seems to come up all the time, and it's hard. Well, I work hard to shut up because I could tell everybody all the time what I think. So now, Erica, back to you, love.
I don't remember where we're going from here.
I think the key takeaways, maybe.
I think so. First, one thing we did want to mention also. So when women do end up on hormone replacement therapy, they're often told at the age of 65 that they need to stop it. A recent study was recently published in the last few months that really highlighted that there is no need to stop your hormone therapy at age 65, that you can continue beyond that. And one of Nancy's favorite saying is, continue until the day you die.
You want a patch on your body the day you die.
The study, what was significant about the study is it showed, like we'd mentioned before, that the overall decreased risk in mortality from all things: breast cancer, lung cancer, colon cancer, heart disease, blood clots, irregular heartbeats, heart attacks, dementia, those are all significantly decreased in women who are on hormone replacement therapy. The article I thought was interesting because it did say that hormone therapy should be tailored to the individual, which I think any treatment plan for anything should be tailored to the individual.
Absolutely.
So I think, do you want to go over the checklist first, and then we'll do the takeaways?
No, I do want to mention one thing here. There's another article that came out a couple of years ago from the University of Arizona, where they're doing a study on hormones and Alzheimer's disease. And what they said at that time, a couple of years ago, if a woman is on estrogen or, hormone therapy for 6 years, they were seeing a 79% decreased risk of Alzheimer's or other neurodegenerative diseases like Parkinson's. And I found that wonderful, very, very supportive. So, yeah.
So I think we'll hit, a lot of us are familiar with the more common symptoms of menopause, like night sweats and hot flashes. But there's a whole host of symptoms that are very common in menopause. So I don't know if Rebecca, you can put up that checklist.
So the checklist Rebecca is putting up is one we use before we see a patient. And then we use it again after we put her on estrogen for a few weeks. So if you look at it, some of this we've already covered well, but first of all, it says hot flashes and night sweats. Those can go on day and night for years and years and years. Women have sleep disturbance because of these surges of adrenaline. So they're frequent awakening, their mind racing, hard to get back to sleep. They end up fatigued, weak, and with memory loss and foggy thinking because they're just not getting the rest. And of course, also estrogen, which impacts the cells of the brain, is disappearing.
Other symptoms, the depression, irritability, mood swings, just being tense, easily tearful, the isolating behavior, that also has to do with just the drop in estrogen. And the going, just feeling like you're going crazy. The anxiety and panic that can come and go along with heart palpitations, lightheadedness, dizziness, chest pain. And show this little diagram. I don't know if you guys can see it. This is kind of what your hormones are doing during perimenopause and menopause. And a lot of the symptoms sorry, Nancy, are not, a lot of them are due to low estrogen, but they're also due to the wide fluctuations that you see from high to low. That occur during this time. It looks kind of like a Richter scale during an earthquake. Other symptoms, the disrupted daily function, lost days from work, bloating, flatulence, gas, those tend to occur because when our estrogen levels are low, that low estrogen in the gut tends to slow motility and movement of foodstuffs through the gut. So that increases the gas byproduct in there.
Rebecca, could you put the symptom checklist back up? Okay.
And then the one that was my huge thing was the muscle and joint aches and pains, just from lower estrogen levels and lack of lubrication in those joints and tendons and ligaments, hair loss, dry skin. That actually we can show this too at that time. So this is kind of a schematic of what happens. Sorry, Rebecca, we're having to switch back and forth. Happens with, as you hit the blue line or the dark line, is estrogen levels just declining. And those rapidly drop right about the age of 50, 51.4 in the average American woman. And the red line is testosterone. So at around late 40s, if we don't do something to supplement the estrogen, we are more testosterone dominant, which can cause a lot of that male pattern baldness, hair loss, irritability, isolating type behavior.
Okay, Rebecca, you're back.
Check this back up. One last thing, the skin crawling, sensitivity to touch, and numbness is something that some people do experience.
A lot of women come to us also experiencing more migraines at this time if their migraine headaches are associated with drops in estrogen. And you saw those drops and rises and drops. Those drops again cause surges of adrenaline. Adrenaline constricts blood vessels, and it kicks in migraines in women who are susceptible to that. But we can help that with the right hormones. There's weight gain, I mentioned that. The body wants more estrogen, ovaries don't have anymore, so the body puts on mid-body fat cells, where a little bit is made from the testosterone in those fat cells. When there's those high peaks of estrogen, you can have extreme breast tenderness and nipple sensitivity. goes away as soon as that drops. There's also a lot of sexual problems in women with during this time and then after the estrogen is all gone. They have vaginal dryness, they have vaginal itching, burning. They just are miserable. Often just even walking can be bothersome because of that vagina being so dry. They try to have intercourse, there's pain, there's bleeding. And husbands or partners realize that. Husbands particularly know they're hurting her, which doesn't help at all. And for the woman, there's lessened sexual drive, lessened sexual activity. Very difficult trying to achieve an orgasm. That becomes, for many, just almost impossible.
And then the last couple, frequent vaginal or urinary tract infections happens when, as Nancy said, when we hit menopause and our estrogen levels tank, that our private parts, all that area really tends to dry up. And that skin becomes more friable and more susceptible to bacterial, invasion of bacteria and causing infections. The leaking of urine with either when you really need to go to the bathroom or with stress incontinence, like with a cough or sneeze, becomes a problem because, again, that lack of estrogen in the genital area makes those tissues just much less competent.
Okay, so we obviously are believers in estrogen. Not everybody can take it. Most women can. I believe Erica too, we pretty much use the patch. I do want to mention one thing that we come across, and that is something called the pellet that is offered to many women. The pellet is something that they inject into your behind. It's about the size of a
grain of rice.
Yeah, grain of rice. So injecting it is invasive. The process is expensive. And the sadness is you have no control over the dose. And I've seen women that have been given too much testosterone and really suffer with too much testosterone. So there's a lot of misinformation and a lot of inadequate information out there. And what we're beginning to see, and it was just something that I listened to today from a couple of doctors saying that this business of, I love the term they use, doc in a box. That doc in a box is becoming a big business. But many of these people putting things out on the internet are really ill-informed. So we want you, if you choose hormones, to find the right practitioner. The Menopause Society trains us, and we have to take an exam to become a menopause practitioner. So any of you looking for a menopause practitioner, if you Google menopause.org, and then I think it asks for you to put in your zip code, and then a lot of names will come up and you can go right down the list and find somebody that's close to you, call and find out if, well, they should be doing beautifully. And I think that's your best bet to get the right kind of care that we deserve, we all deserve.
So I think some key takeaways, things we really want you to take away from this talk, are not all hormones are created equally. One thing really important if you're talking to a provider about hormone replacement therapy is to know what route they're talking about. Are you getting it through the skin, the pellet, or a pill? Okay, those are all very important things. One thing that really needs to be highlighted when you're talking to your provider is not is the impact that menopause is having on your quality of life. And just to realize that. And then the health benefits of hormone replacement therapy, prevention going forward, and really health promotion. So those are really important things to bring up when discussing.
And do not be afraid to say, my partner and I are no longer having sex. I want help. Doctors are reluctant to ask women about sexual encounters, and that's a tragedy. But hopefully one day this will become more and more comfortable. But don't be afraid to, like I said, mention, like Erica said, mention your symptoms, let them know what's happening to you and that you want help.
And I think also don't just accept, I think it used to be, and still sometimes people think, oh, hormone replacement, it's just for the hot flashes and the night sweats, and I can power through this, it's going to get better. And yes, you may be able to power through those symptoms, but at the same time, that's also causing, problems with heart disease, brain health, bone health. So it's not just to feel better or feel younger. It's not just for glamour. It's actually for your health.
Yes.
So
much healthier lifestyle.
Don't be afraid to bring up like, gosh, I am just not me anymore. I don't feel well. I'm not sleeping. Those are all really critical things to your overall health.
And if they're unwilling, ask, is there somebody you can send me to? Do you know of anybody? Because this will hopefully get them thinking more and wanting to find more of themselves. It's coming. There's been, in the last 3 years, there's just a wealth of information out on the internet about hormones. So it's coming, but it's not 100% here yet by any stretch. So we know you may have questions, and I think if you have, you've been sending them into Rebecca.
Yes. So if there are any questions, feel free to put them into the chat.
Okay.
So I do have a question here. Can I start hormone therapy at age 70 if I've been off for 15 years and had breast cancer?
Oh, well, let me answer this. Yes to age 70, yes to off 15 years and have breast cancer. I, as a nurse practitioner, am uncomfortable in that situation. But there is a physician in the area who will definitely talk to her, look at her information, and likely start her on hormones and write a note to myself or Erica or one of the other nurse practitioners and say, yes, put her on.
So I think what she typically does is looks at the history of the breast cancer. It's been in remission for how long?
Yeah.
All those things are really important in that situation.
Right. But oh gosh, yes, this physician is wonderful at seeing these patients. So I would say, don't say no, don't say never. But any 70, 75, up to 80 even, I've put many women on, and we do put them, when we put them on, we start very, very, very low and move up very, very slowly. So it's just like reintroducing. Now, it won't correct problems. It won't correct if there's heart disease that's developed. It won't correct if there's, buildup of plaque in the brain, but it will probably stop any further buildup of plaque.
Stop or slow progress of the disease.
Stop any more bone loss, those kinds of things. So the progression does not continue.
Nancy, are you able to share the name of the physician that you recommended?
What I'm going to have to do, Rebecca, is ask her if it's okay.
Understood. Okay. Thank you so much.
Sure. And then I can let you know if you'd like me to.
Absolutely. I would very much appreciate it. Since you already know the doctor, and I can definitely share that out.
Yes.
Also in the chat, I did include the handouts, the symptom checklist that Nancy and Erica reviewed previously. So please feel free to download that if you wish. And I wanted to see if there are any other questions. You can direct chat me if you wish. Okay, next question. I was diagnosed with triple negative breast cancer last year at 38, and I'm also high risk for ovarian cancer. My oncologist is recommending a hysterectomy for preventative measures. I understand this will force me into menopause. I know I will have to be on hormone therapy. Will my age matter?
Phew. Well, she's up a creek. Hysterectomy is important. Again, as a nurse practitioner and not being a physician, I've never felt like I'm in a position to prescribe to a woman like this. So I would send her to the physician that we've been talking about. Do you have anything else you want to say?
As far as does age matter, I think I'm not sure what is menopause starts as soon as the uterus and the ovaries are removed. I don't know if that's what her question is, but yeah, that's when menopause would start.
And she's young. What did you say her age was?
38.
Yeah.
Yeah.
So she's another maybe 12, 14 years without any estrogen. And without estrogen, she's much more likely to develop a lot of diseases and to die younger. And that's sad.
Without hormone
Without
replacement
hormones,
therapy.
yeah.
So that would be important for her to.
So we would both want to try to get her to this physician and you know, get her on some hormones. Yeah.
Thank
Next.
you. Yes. Any other questions? Feel free to put them into the chat. You can direct message me as well. I just want to say thank you so much, Nancy and Erica, for sharing both of your stories and just being honest. Being honest with the group about the symptoms, about what what can be helped to women, what it may not help, and so you appreciate the information.
Yes.
Absolutely. Noelle, did you have a question?
I just have a comment. Hi, Nancy.
Hello.
I was your patient in December.
Okay.
And it's been a miracle. Thank you so much for getting me back on hormones. Feeling better. We're still adjusting the dosage, but I feel so much better. And for the audience, I had DCIS in 2018. I had a lumpectomy and sentinel nodes taken out, which were clean, and I had radiation therapy, and I was on tamoxifen for about 5 years, and I've been wanting to get back on hormones. I've been a fan of Nancy's for years and years, listening to her talk at various venues, including CSC, and she got me back on hormones. And the reason I went back on hormones is mostly it was for quality of life, but also I'm pre-diabetic. I have I just started. I had osteopenia for many years, and I'm on the osteoporosis realm in one hip. And I know that it's just going to be very helpful to my overall health. So I appreciate it and thank you. Also, you didn't mention it. I think you're the one who told me the thing about when they talk about not being more at higher risk for heart disease and breast cancer and all that kind of stuff. You have to start to think about if that were true, if hormones are the cause of these, then young women should be getting all of these medical problems that don't. It's only after our hormones are diminished and decrease that all these health issues come up. So I do agree that hormones do protect us.
Oh, they do. Indeed.
From all these things. So thank you very much for all your work that you do.
Just a comment on that, Noelle. There was a graph, and I don't remember what study I saw this in, that showed after 2002 the incidence of coronary artery disease in women has steadily climbed until more recently it's kind of leveled off.
Good.
And so they did not attribute it to the WHI, the study that took everyone off hormones, but in this article they did start to connect those dots. Yeah.
And then another thing, Nicole, I want others to hear. You had DCIS, which isn't cancer, it's a pre-cancer.
Mhm.
And they apparently got it all. And so, you're a simple, easy candidate for estrogen, but not oral. It's the oral estrogen that creates the problem, not the transdermal. Transdermal is a gift. I don't know how else.
Yes.
I call it
Your miracle patch.
my miracle patch. And I want this miracle patch, like we've already said, on this body the day I die. And so I say it on my first visit with patients, I say that to them. And then when they come back, I always do 2 visits. They come back on the second, and on the second visit, I almost always say, well, now how long are you going to use this patch? Until I die. And I go, yay, A plus, A plus. But women are getting that, and it's wonderful. So.
And Nancy, I just want to point, you have several women who have had breast cancer that you take care of.
Oh, yes, I
correct?
do. Yeah. But everyone, there used to be a doctor in Orange County, Dr. Desaya, that I would send all my women with breast cancer to. And he would see them and then send me a note, or the physician here. I'll send them to, and then she sends me back a note. So, but I personally, being a nurse practitioner, and the feelings by some, like physicians and oncologists, of me putting somebody on, it's just, I don't want to lose my license by somebody, whatever. So I just don't. I want a doctor behind what I do there.
Yeah.
Do you have any different thoughts?
No, I do. So we both have some patients who've had breast cancer, and definitely we'll still see them and educate them, give them, resources like this Estrogen Matter book. So it's not just us saying, oh, everything's fine. Dr. Bluming is an oncologist, right? Whose wife had breast cancer. And he is a big advocate for women going back on hormone therapy after breast cancer. But we do want them to see their oncologist or a physician, preferably an oncologist, to clear them and say, I am okay with them going back on hormone therapy.
Yeah. We need to be cautious and careful, and we don't want to hurt anybody for certain.
Wonderful. Thank you for your honesty and for your caution there. Are there any last questions? Feel free to put it into the chat. And thank you so much, Noel, for sharing as well. I think it's always good to hear from people, like more people, that it has impacted, and their testimonials as well.
How do you get on your website?
EricaBuckNP.
Okay. I want to say this. We both have websites that have a lot of information. Erica's is EricaBuckNP at
just EricaBuckNP.com.
And mine is NancySiskowic.com. So if any of you want to further look at what we have to offer, you can go on our websites, and they have some pretty good information on them.
And I will put both of those websites into the chat function. EricaBuckNP.com and NancySiskowic.com.
Correct.
Thank you again so much, both, for your time, and everyone for joining us today.
Well, you're more than welcome. Oh,
thank you. Thanks for having us.
Yes.